is Sandra Yusuf, and I'll be your nurse today. And we're just going to briefly discuss your mouth surgery. And while we're talking, if you have any questions or concerns, feel free to stop me at any time, and I'll do my best to answer your questions. Are you ready to start?
Let's go.
Okay, so you'll be undergoing mouth surgery to remove your basal cell carcinoma today, which is a type of skin cancer, which I'm sure you're aware of. Basal cell carcinoma begins in the basal cells, which is a type of cell within the skin that produces new skin cells as old ones die off. Basal cell carcinoma typically appears on the skin as slight bumps and is usually caused by frequent sun exposure. Have you had a lot of sun exposure as a child?
As a child, I had a lot of sunburns.
And did you ever use any preventative measures like sunscreen?
No, never.
And that's probably your main reason why you have basal cell carcinoma today, but we're just going to try and prevent it from ever happening again after we remove it. So the main purpose and goal of the mouth surgery is to see how extensive the cancer actually is and completely remove it. The surgery will be performed by a mouth surgeon who is a board-certified dermatologist. So the surgeon will begin the procedure by removing the tumor from the epidermis, which is just the superficial layer of the skin. The surgeon will then divide the tumor into sections and examine it under the microscope. Depending on what he sees under the microscope will allow him to determine his next step. So if he sees that he removed the entire tumor, then he'll stop the procedure and he'll be done. And if he sees that he didn't get the entire thing, then he'll go back in and remove the second stage, which just means he'll get the rest of it.
Right.
After the entire basal cell carcinoma is removed, the surgeon will just close your incision site with stitches.
How long will the surgery be?
The surgery will be about 5 hours long, but depending on how extensive the tumor is, it may take longer. And do you have any other concerns?
No.
Okay, so we're just going to go over any risks. So with any surgery, there are risks, but the main risk that you have is scarring after the procedure. So the best way to prevent scarring is to don't pick out your stitches and to follow your detailed written wound care instructions, which I'll give to you after the procedure. And most wounds aren't painful after surgery, but if you are feeling any discomfort or pain, you can just take any medication like Tylenol to alleviate that. And so after the procedure, you'll have a follow-up appointment, and because your stitches will be on the anterior surface of your face, which is the front, then your stitches will typically need to stay in for 7 to 10 days. So your follow-up appointment will be in 1 to 2 weeks. And please let us know if you have any special concerns or questions. We look forward to seeing you.
Thank you.
All right. Have a nice time.
You too.
All right. Bye.